Canine distemper is a highly contagious and often fatal viral disease that affects dogs. It's a severe illness that can cause a range of debilitating symptoms, from fever and respiratory problems to neurological complications. Sadly, distemper can be fatal, especially in puppies and older dogs with weakened immune systems. Understanding this disease and taking steps to prevent it is crucial for every dog owner. This virus attacks multiple systems in a dog's body, including the respiratory, gastrointestinal, and nervous systems. This makes it a multifaceted threat, capable of causing a wide range of health issues. Because there's no cure for canine distemper, prevention is absolutely critical. Protecting your furry friend starts with understanding the risks and taking proactive measures to keep them safe. In the following sections, we'll delve deeper into how distemper spreads, the warning signs to watch out for, and most importantly, how to prevent this devastating disease from harming your beloved companion. Canine distemper spreads easily from dog to dog, making it a significant concern for pet owners. The virus is primarily transmitted through the air, often when an infected dog coughs or sneezes. These airborne particles can travel some distance, putting unvaccinated dogs at risk even without direct contact. Direct contact with an infected dog's bodily fluids, such as saliva, urine, or feces, is another common mode of transmission. This can occur during play, sharing water bowls, or even just sniffing an infected area. The virus can also linger on contaminated surfaces like food bowls, leashes, and bedding. This means your dog could pick up the virus from objects that have been in contact with an infected animal. Wildlife, such as raccoons, foxes, and skunks, can carry and transmit canine distemper. It's essential to prevent your dog from interacting with wildlife, even if they appear friendly or seem to be in distress. Finally, pregnant dogs infected with distemper can pass the virus to their puppies in the womb or through their milk. This highlights the importance of vaccinating breeding dogs to protect both the mother and her litter. Canine distemper is a multi-systemic disease, meaning it can affect various parts of a dog's body. Recognizing the early symptoms is crucial for seeking timely veterinary care and potentially improving the chances of a positive outcome. Early signs of distemper often resemble those of a common cold, making it easy to miss the danger. These include fever, loss of appetite, lethargy, discharge from the eyes and nose, coughing, vomiting, and diarrhea. As the disease progresses, neurological symptoms may develop, including muscle twitches, seizures, paralysis, head tilt, and circling. These neurological signs can be devastating and often lead to long-term complications, even if the dog survives the initial infection. If you notice any of these symptoms in your dog, it's essential to contact your veterinarian immediately. Early intervention is critical for providing supportive care and managing the symptoms of this serious disease. Now, let's talk about diagnosis and treatment. Diagnosing canine distemper can be challenging, as early symptoms often mimic other common canine illnesses. Your veterinarian will conduct a thorough physical examination and ask about your dog's medical history and recent exposure to other dogs. To confirm the diagnosis, your vet may recommend several tests, including blood tests to check for antibodies to the distemper virus, urine analysis to detect virus shedding, and the examination of eye or nasal discharge for the virus. Unfortunately, there's no cure for canine distemper. Treatment primarily focuses on providing supportive care to manage the symptoms and keep the dog as comfortable as possible. This may include intravenous fluids to prevent dehydration, medications to control seizures and other neurological symptoms, antibiotics to prevent secondary bacterial infections, and nutritional support if the dog has difficulty eating. The prognosis for dogs with distemper is guarded and depends on the severity of the infection and the dog's overall health. Early diagnosis and aggressive supportive care can improve the chances of survival, but there's no guarantee of a complete recovery. Vaccination is the cornerstone of canine distemper prevention. The distemper vaccine is highly effective at preventing this deadly disease and is considered a core vaccine for all dogs. Puppies receive their first distemper vaccine around 6 to 8 weeks of age, followed by booster shots every 3 to 4 weeks until they are around 16 weeks old. After that, adult dogs typically receive booster shots every 1 to 3 years, depending on their lifestyle and risk factors. It's essential to keep your dog up to date on their distemper vaccinations even if they are primarily indoor dogs. Remember, The virus can spread through the air and on contaminated objects, so even limited exposure can be risky for unvaccinated dogs. In addition to vaccination, minimizing exposure to potential sources of infection is crucial. This includes avoiding contact with unvaccinated dogs, especially in areas where dogs congregate, such as dog parks and kennels, keeping your dog away from wildlife, including raccoons, foxes, and skunks, and maintaining good hygiene by washing your hands thoroughly after handling other dogs and cleaning up any pet messes immediately. Protecting your furry friend from canine distemper is an ongoing responsibility that requires vigilance and proactive measures. Here are some practical tips to safeguard your dog's health. 1. Vaccinate your dog. This cannot be overstated. Vaccination is the single most effective way to prevent distemper. Follow your veterinarian's recommended vaccination schedule for your dog's age and lifestyle. 2. Socialize safely. Socialization is crucial for puppies, but it's important to do it safely. Choose puppy classes with strict vaccination requirements and avoid dog parks and other high-risk areas until your puppy is fully vaccinated. 3. Be mindful of surroundings. When walking your dog, be aware of your surroundings. Avoid areas where wildlife is common, and keep your dog on a leash to prevent them from scavenging or interacting with unknown animals. 4. Practice good hygiene. Wash your hands thoroughly with soap and water after handling other dogs, and clean up any pet messes promptly. This helps to minimize the spread of germs, including the distemper virus. 5. Don't breed unvaccinated dogs. If you plan to breed your dog, ensure they are up to date on all their vaccinations, including distemper. This will protect both the mother and her puppies from this devastating disease. Remember, canine distemper is a preventable disease. By taking these steps, you can help keep your beloved companion safe and healthy for years to come.